Hi everyone, my name is Olivia Gergely and I am a health studies student who minors in psychology at the University of Regina. And I have a strong interest in women's and sexual health, and that's what made me choose my placement here at the Regina Sexual Assault Center. So, the Sexual Assault Center is a nonprofit organization that offers many different resources, such as free counseling for people who have experienced sexual violence, advocacy to the police station or in the hospital, 24/7 crisis line, and public education and outreach, which is where I come in with my special project, improving the mental health outcomes during pregnancy, labor, and postpartum for survivors of sexual violence. The purpose of this was to bring more awareness and educate health professionals on the unique care that survivors need during their perinatal journey. And this is because the procedures and practices can re-traumatize survivors in healthcare. The first step of my special project is to develop research questions. So the second step was to conduct research and write a report. And this was the most intensive process of my special project because at the start I really didn't know where to begin because this is a very specific topic that's not very frequently spoken about or even researched on. But once I got the ball rolling, I kind of gathered so many resources that it was overwhelming. And this took about the first 2 months of my placement. So the third step was to interview health professionals on how they address the gaps in care and how they give care to survivors during this period. And this didn't really go as planned, as I reached out to a few different professionals for an interview and some didn't follow through, but I did make one really special connection with a doula who gave me lots of valuable information. And this step really helped with one of my learning objectives, which was to make more connections and networks. The last step is to finally present my findings and also identify who I wanted my audience to be. I ended up having people sign up for my presentation from the Early Learning Center, from Sask Health Authority, YWCA, just anyone who is working directly with people who are experiencing trauma. I'm grateful to say that I believe my special project was successful because it got really good feedback. For example, someone from SHA wanted the recording to possibly show SANE nurses, and another was really interested in the screening information that I had referenced in my presentation. I think the most valuable part of my project was that I did bring more awareness to a subject that's not talked about a lot. I had so many people tell me I was doing valuable work, and I'm just so grateful that I created a conversation in the community to enhance the care that survivors receive.